Many thanks for staying with us. Now, the Cancer Association of Namibia remains committed to raising awareness about the critical role of early detection in combating cancer. Now, to support this mission, the Cancer Association of Namibia last week organized a pap smear and breast examination event at their head office in Windhoek West. And joining us today to reflect on this event, as well as, of course, the importance of early detection, is Dr. Gerrit Keyter, who is the Cancer Association of Namibia's head of medical services, and he's here to discuss the significance of screenings. Doc, a very good morning to you, and thank you so much for being with us this morning.
Good morning. Thank you for having me here.
Always a pleasure having the Cancer Association of Namibia. First and foremost, before we reflect on last week's activities, how are you guys doing, first and foremost?
We're doing good. We're doing good. We're getting busier, seeing a lot of patients, helping a lot of Namibians. But yes, overall, we're doing good.
Fantastic stuff. And of course, in an effort to get ahead of this disease, you organized, a pap smear screening campaign, basically, comprising of pap smears and, of course, examinations as well, breast examinations, that is. Talk to us about these events and these activities and, of course, the turn-up from the public here.
Yes, so last week we had a screening for pap smears and breast examinations. Tuesday, Wednesday and Thursday last week. It was the independence screening campaign we had. And we had a very good turnout of patients. There's such a need for early detection and for screening of cancers, and it's not always accessible. And that's one of the reasons the Cancer Association that we are organizing these events, that we can make it more accessible. It is it's $35 they've paid, which is actually really cheap compared to your private practices. And then the other thing is, in the state clinics, we get the complaints that they don't always have the equipment available, or they don't always have the staff available there. So that's why we make it more accessible for the patients to come for these screenings.
Fantastic. Roughly how many women did you reach through these screenings here?
Last week, the 3 days, so first day there was a lot of rain, so we expected we didn't get so many patients then, but overall it was around 150 patients.
Wow. Yes. That is a good number. That is a good number. Of course, looking at past events as well, it's not the first time that the Cancer Association of Namibia is doing something of this nature. Looking at the past activities as well, how do you, especially when you talk about educating the public on the importance of screening, is the message getting across here?
I believe the message is getting across. It's all about repeating the message. You need to emphasize on the importance of screening. And it's actually getting to the patients. You can see we're getting a lot of younger patients now. Usually it's more the older patients who come for the annual screening. But we want more younger patients to actually come for the screening. And it seems like we are reaching them, especially via the social media platforms. And Cancer Association is quite active on the social media platforms. So we are reaching these patients. And it's actually important, the younger you start your screening, the better for you, for your health overall, because early detection, that's the main focus. That's the main thing about the screenings.
Very much. And of course, when we speak about these age groups, Doc, how young are we speaking of here, ideally?
So usually for the pap smear patients, it's around early 20s that we start seeing patients. So for pap smear patients, it's usually when patients start with sexual activity, and it's usually around the early 20s that we're starting to see these patients. But the youngest I've seen was 19, and the eldest I've seen at one of these screenings was 65. So there's a big age range that we're working with. What is really important actually is the breast examination screenings, because we tend to forget about breast examinations and I always encourage during these screenings that the patients do their monthly own breast examinations, because you have power over your own health. And I can assist you and the medical staff and the nursing staff. We can give information and we can assist patients, but ultimately it's down to you as an individual.
And Doc, we know, we know the personal pains, the joints, the lumps that you're feeling in your body, etc. So ultimately, it's about being honest with oneself and, of course, being honest with health practitioners such as Dr. Keyter. Let's talk about some of the barriers. You mentioned earlier on, of course, the costs of these screenings is one huge barrier, especially in the private sector. Whereas in the public or the state sector, you have issues of equipment, a lack of staff, etc. Just how dire is the situation, Doc?
It depends where you are. It really, in Namibia, for your healthcare, it's all about some regions that really do lack staff and equipment. Other regions are more well-staffed and better off equipment-wise. Yeah. So it really depends on where you are. But we do see, the main thing is in the rural district clinics, we do have a lack of staff and equipment. And there's a lot of procurement issues going around with that, and getting the speculums, for example, to these clinics, getting the slides to these clinics, because eventually when you do your pap smear, you send in your slide to the lab, and there's a certain time limit also on the slide. It needs to get to the lab, and then the accessibility of these slides. So yeah, it all depends on where you are. The private sector, again, you can do, it's usually available in the private sector, but then it's not always financially accessible for all the patients. Yeah.
Those are some of the deterring factors. Let's talk about some of the more personal deterring factors as well. Of course, a lot of people, a lot of women may find some of these procedures perhaps a little invasive, for lack of a better word. Talk to us about how you deal with that, and also just perhaps while doing that, just encouraging people to, understand that it's perhaps not that bad, but it's all the more important that you undergo this process here.
One of the biggest challenges we see with patients is the fear factor. And patients are, especially when it comes to cancer, patients are scared of hearing that word. They're like, they're going to go for the test and they don't know what they're going to get. They're scared of this. Yeah. But at the end of the day, it's like I mentioned, early detection. If we detect it very early, we can actually treat it much easier, much more effective. Yeah. So that is definitely one of the, like on a social, psychological issue, that is one of the biggest factors we're seeing from the patients. And then, of course, they're not always comfortable with the healthcare workers, for example, or with the equipment they are using. Yeah. So at the Cancer Association, we actually make sure that we're using a comfortable speculum, I can say. It's not the stainless steel ones that they use in the government settings. So, and it's very easy to use. You can do it very fast, and then you do your test, and then the patient is done.
Very much indeed. Doc, what we often see is, women tend to show up more for these screenings. Women tend to show up more for regular health checkups, etc., as opposed to men. Can you perhaps speak to us about that, and how can we get through to men to, of course, better care for themselves, so to say?
Yeah, that's a common problem we're facing, especially in the African context. I mean, Namibia, we see it on a daily basis. Last week, with the screening, we did the prostate screening or the PSA screening with the pap smear and the breast screening, and I mean, we saw so much more ladies. Ladies in general are just much more, they take their health much more into their own hands. I think it's also this caring personality that women also have, and men, they tend to go very late to see the doctors, and then when it comes to that point, then it starts getting very difficult to treat the different cancers. It's all a stigma associated with that, but there is a turn in this. You can see that there's a turn in the stigma, but it's taking time.
Very slow.
And it's all about spreading the word, spreading the importance of going for your annual screenings, because again, early detection, that's the key.
Absolutely. Doc, just in conclusion, we know that cancer continues to cause havoc in our societies, to cause havoc in families. Of course, we know of the psychosocial impact of it as well, and often the wounds that it leaves as well, for many of those who remain behind, survivors, etc., but also the family and relatives of those. Just as a community, as a society, as, organizations, how are we doing in this fight against cancer, and what more can be done from where you sit here?
We're definitely improving, but there's still a lot that needs to be done, because we're seeing growing numbers of cancers, not only in Namibia, overall globally we're seeing these numbers increase. In Africa, we're seeing these numbers increase.
Yeah.
So there needs to be much more emphasis, again, on early screening.
Yes.
Because in your low and your middle income countries, it's the most effective way of actually dealing with these cases.
Absolutely.
And with the modern society we're living in, there's all these risk factors, nutritional risk factors, environmental risk factors.
That's the habits we pick up.
The habits, smoking,
Yeah.
bad smoking habits, all these things. And these are all causes for rise in cancer cases. So it's really important that everyone needs to be aware of this. It's a growing concern.
Yeah.
It's picking up, and we should not be scared of this.
Very much.
This is a treatable condition. And if you go for your screenings and pick it up early again,
very much.
you can save a lot of lives doing that.
Absolutely. What's next on the Cancer Association of Namibia's calendar? What can we expect for 2025 here?
There's still a lot of screenings taking place. So on the social media platforms,
Yes.
check out for the dates when we're doing our next screenings.
Yep.
We usually do, like on a 3-monthly basis, we do the pap smears and the PSA testing.
Nice.
But check the social media for the dates. It's all on there. And then, of course, we also hold these events for the walks, the cancer walks,
Yes.
and then also some big social events later on in the year.
Yep.
So just follow the pages, and all the news will be on there.
Very much. Dr. Keyter, thank you for being with us. Thank you for the work that you're doing at the Cancer Association of Namibia. And of course, keep up the good work here.
Thank you.
Yep. There you have it. Dr. Gerrit Keyter, he is the head of medical services at the Cancer Association of Namibia, talking to us about public screenings they had last week on the 18th, 19th, and 20th of March as part of their independence of screenings. Of course, only costing patients some 35 Namibian dollars. We saw pap smears, we saw breast examinations happening, as well as, of course, prostate inspections happening there. And just as you heard there from Dr. Keyter, calling on men to please show up at events of this nature to ensure that we do get ahead of cancer. As you heard there, screening is better. Of course, prevention is better than cure. Please stay with us.